control of cost, protection of quality, and coverage for all of us. The members that I represent, we represent about 3,000 healthcare workers in the state, and they're, of course, uniquely positioned because they see every side of this issue. They see the people who have come in too late. They've seen much more of this recently because of the expansion of these high deductible plans. They're picking these plans because they can't afford a good plan. And so they think, at least I have some plan, but in fact they don't have the money to put aside for these, $2,000 or $3,000 deductibles, so they actually get no care, and then they are very sick coming into emergency rooms. These are like tricks that they've played on people to say you have insurance by giving them these high deductible plans, when in fact they can't afford to ever come in and use it. So much of our conversation is about access and people not getting in and people having no insurance. I mean, the costs are killing us. The cost to our employers, the cost to our members. We have members in some places in the state where we represent housekeepers, food service, and so on, that they'll take home a $10 check because their entire paycheck is going for their premium, because they're paying $500, $600, $700 a month for their premiums, and then they still have out-of-pocket costs. So both for the workers and for the employers, part of what we have to say is every employer has to share this burden. Because one of the reasons our employers are paying so much is because they're covering spouses who work for companies who will not provide insurance. It's very critical that in whatever reform is done, that there's also attention paid to an oversight for the quality of care. Because otherwise, you're going to have cuts at the front line, elimination of staff, elimination of housekeepers. I'm telling you, already this is happening. We have all these infections going on because they've cut the housekeeping down to bare bones. They cut the nursing down.